this great nation in a way that allows them to better understand what is part and parcel to the Affordable Care Act. A monumental piece of success. Is it perfect? No. We aimed for perfection. We struck with progress. But there is many a benefit that is part of the Affordable Care Act, and we're witnessing an attempt here, an all-out attempt by the Republican majority to turn that success into failure.
Well, let me pick up on that, Mr. Tonko, and you're quite correct. It's not just an attempt. There have been 33 votes on this floor by the Republican majority to either terminate completely or to eviscerate in part the Affordable Health Care Act. Now, what would be eviscerated? First of all, the Ryan Republican budget would terminate Medicare as we know it and give to every American who is not yet 55 years of age a coupon. It basically says this coupon is worth 70% of the cost of insurance. Go get your insurance when you become 65 from a private insurance company. No longer would Medicare be available to all of those people who will eventually be 65. And for those people that are 55 to 65, it makes it impossible for Medicare to go forward on a financial basis because it takes away the younger people. I heard something on the floor which I just said, wait a minute. Some statistic that was tossed out here just a few moments ago that more people die on Medicare than die on regular insurance. Yes. Medicare is for the elderly. Medicare is for the elderly. Yes, they do get medical care, but eventually they get old, and yes, and I will too, be on Medicare, and I will die on Medicare, and I'm so grateful that I have Medicare available to me when I become 65, because I know I've got a solid insurance program. I know that I'll be covered. And I know that my younger brother and sister will be covered when they become 65. They will have quality care, and guess what? They will die on Medicare. Yep, that happens. You're on Medicare for the rest of your life. It may be for a year, it may be for 30 years, but whatever, you've got a guaranteed benefit that's available to you. And what do you lose if the Ryan Republican budget and the effort to repeal Medicare is lost? Well, let's see. Nearly 13 million Americans will benefit from $1.1 billion in rebates from their private insurance companies that are presently overcharging them. 86 million Americans, including 54 million Americans on private policies and 32 million Americans that are on Medicare, will lose their free preventative services. Now, you want to reduce the cost of health care, then you've got to make sure that people stay healthy as long as possible. And how do you do that? Blood pressure. You want to deal with blood pressure? Okay, it's very cheap if you get your medicine, but you've got to find out about it, so you need that free checkup. Diabetes, stroke, all of those things can be delayed and often prevented if you know it's coming. So, what are we talking? 32 million seniors will no longer have a free checkup, preventative services. In August, just a week from now, women will begin receiving free coverage for comprehensive women's preventative services, Pap smears, breast cancer checkups. You want to repeal that? That's what the Republicans have voted 33 times to do. Repeal the free checkups for women in America. 105 million Americans will no longer have a lifetime limit. Let me put that a different way. 105 million Americans will have a lifetime limit once again. Today, they do not have a limit. So if you're 30 years old, you have a private insurance policy, and you get cancer, you'll hit that lifetime limit immediately, not under the Obama Cares program. That program, there are no lifetime limits, and you'll continue to receive the medical benefits. Mr. Tonko?
Well, thank you, Representative Garamendi. You know, one of the things you talk about with the influence or the focus on women's health care reminds me of the pre-existing conditions that are precluded now as a rationale for denying insurance.
Yep.
And pre-existing might mean in youth, asthma, in our senior population emphysema or cancer recovery or cancer struggle. But it can also mean, in a gender-related bias, being a woman. That is used as a pre-existing condition. Being a woman, a pre-existing condition. So the benefits to women, as you outlined, in the direct services, the screenings, the mammograms, and the like, are a portion. The other portion is just being born a woman can deny you insurance. So, you know, when you talk about the 30 cents on the dollar that the voucher would carry for the Medicare recipient, and they're asked to go shop, this is saying that compared to today's standards, it's the senior digging much deeper into her pocket. It's the senior digging into another pocket to be able to afford his Medicare voucher portion. And that's unacceptable. That is playing to a special interest. And that's what I believe the espoused virtue of this deny, this repeal, is about. It's about playing to special interests that don't want to be told that there's a transition here, that there's a new day in America for healthcare consumers, and that the heart has been poured into this to be more sensitive, to address a moral compass that this nation has always uniquely embraced, that we are a compassionate society, that we are going to make a difference out there, that we are solutions bound. And that's what the Affordable Care Act was about, presenting a new approach to health care, providing more freedom and opportunity to our seniors, to our children. If you're 26 and under, staying on your parents' policy. These are the formulae for success that allow us to go forward with much more dignity, much more success, cost containment, affordability, accessibility. These are the dynamics of reform. And why would you repeal something here other than to respond to special interests?
Well, exactly so. For 8 years, in the early 90s and then in 2000, I was the insurance commissioner in California. I wish I had this law, because I could have held the insurance companies responsible. Now, my attitude about them is they always put profit before people. However, the Affordable Health Care Act has what we call the Patient's Bill of Rights. And this is the insurance discrimination that is eliminated by this law. And you spoke of a couple of these issues. Discrimination against a woman simply because they're a woman. They have a pre-existing condition. They're a woman. They can get pregnant. So the insurance companies would not cover, or they would charge more. Those days are over. Also, a young child. There are about 17 million children in America with pre-existing conditions that can no longer be discriminated against by the insurance company. They have to be able to get insurance from an insurance company. 17 million children, one of whom is the son of my chief of staff, born with kidney failure. He had insurance the day he was born. He immediately lost insurance because he had kidney failure. And today, as soon as he leaves his parents' policy, which he's able to get now under the law, because they cannot discriminate against children, he will be able to continue to get insurance. Under the old law, repeal the Obama Cares law, and he will be denied insurance because there is an end to the Patient's Bill of Rights. The Patient's Bill of Rights guarantees that insurance discrimination is over. So what do they want here? What do the Republicans want from Americans? A big question. Apparently, they want more money for the doctors, and that's certainly necessary in some cases. Apparently, they say they want government out of health care. Does that mean end Medicare? Apparently, yes, because the Republicans have voted twice on this floor to end Medicare, as we know it. You'll get a voucher. You will not have guaranteed coverage. You'll have to go out and shop for it yourself. Apparently, they don't want community clinics, because they've already voted on this floor to cut about a third of the community clinics in this nation. Apparently, they talk about access, but at the same time, they refuse to fund the residencies for family care, for the basic health care providers that we need in our hospitals, in our communities.